I want to introduce Terry Dalrymple, who is the head of the Global Chain Network. And Terry's worked in largely in Asia and all around the world now, but I think you started your career as a long-term missionary in Asia.
Yes.
So I'm going to let him share with you a little bit about community health evangelism and transformational community development, and what does that look like? So, Terry, welcome.
All right.
Thank you for joining us.
I have to ask this question. Forgive me, but I just can't resist. And those of you who are at home watching won't be able to see the answers maybe, but how many of you are public health professionals? 1, 2. All right, so about half of you are doctors, and half of you are nurses, and 3 of you are public health. And we're the stepchildren in the medical profession. But we have an important role to play. In fact, what I want to talk about today is community health as a framework for global mission, particularly in villages. Our network is in 142 countries. There are about 900 organizations that are involved with us. We have a goal to mobilize the church globally into 1 million villages. I've met with many public officials who said to me, the only institution in our country with the capacity to do what needs to be done in the area of community health is the church. And so we're seeking to mobilize the church. And that gives us a lot of opportunity that we don't find in other ways. Let me just talk a little bit about poverty. At the United Nations, they're beginning to talk about poverty not in terms of income, but using a multidimensional poverty index, saying that there are many pressures that hold people down in poverty. Among them are our health, education, and assets. We would add a number of things to that as Christians, which also hold them down, such as worldview and relationships. But the truth is that poverty is multidimensional. And so using the multidimensional index, the United Nations is now saying there are 1.6 billion poor people in the world, and 85% of them live in rural poor areas. So about 1.3 billion of the 1.6 billion multidimensionally poor in the world live in villages. Does that surprise you? It did surprise me. Here's the missiological side of it, the Christian mission side of it. There are 1,200 plus least reached people groups with no gospel witness among them. Missiologists are saying that 95% of them live in rural areas. And so here's what's happened. We heard the doctors talking about the 80-20 thing. And it's happening with missionaries too, where we're focusing on the urban setting and we're leaving behind those that are most marginalized, most in need of health care, and without the light of the gospel. And so our vision is to mobilize the church into those areas, into 1 million villages. I want to talk a little bit about irresponsible recycling. I was the international director at Medical Ambassadors for a while. Medical Ambassadors is an organization that started out doing clinics, mobile clinics in rural settings. And the frustration that came to them as medical professionals was, we would do a clinic, people would go back and drink the same water that made them sick. The next time we came through with our mobile clinic, we were treating the same people for the same problems. And the community was not getting healthier. And so the question became, what do we do? How do we modify our strategy so that we're really improving the health of the community? 60% or more of the disease burden in the village setting can be prevented through education and sanitation and hygiene and immunization. And so we need this community health component. If we're going to have a integrated system that truly meets the needs of the people, community health has to be a part of it. So I'm looking for the day when there's 1/3 doctors and 1/3 nurses and 1/3 public health people. But we're a long ways from that right now. I want to talk, though, about community health as a platform for total transformation. We started out moving into communities dealing with water, sanitation, hygiene, starting with basic diarrheas and problems like that, and helping the people understand why they have those problems and create their own solutions. Those solutions use local resources. They owned the solutions. They shared it with their neighbors. They passed it on. And we began to see movements of change around the world. And that's where the network really came from. But community health is broader than just immunization and nutrition and sanitation and hygiene. If the problem is malnutrition, the solution is likely agriculture or food security. If the problem is a lack of knowledge, it's education. And so that moves our community health programs beyond the typical health sector into the development sector. And I believe that community health needs to be partnered with community-based development in order to truly lift communities out of cycles of poverty and disease.